Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. November is Stomach Cancer Awareness Month and National Caregivers Awareness Month as well. And joining us here on Health Professional Radio today is gastrointestinal medical oncologist Dr. Samuel Klempner and Christy Leonard. She's a caregiver and advocate whose husband, Tony, battled stomach cancer. Welcome to Health Professional Radio, Dr. Klempner and Christy Leonard. Thank you both for joining us this morning.
Thank you for having us.
Well, Doctor, I did, of course, mention that you're joining us today as a gastrointestinal medical oncologist. Give us a brief look into your professional background, and if you would do the same, Christy.
Sure. I'm Sam Klempner. I'm a medical oncologist. I focus in stomach and esophageal cancers, new drugs, clinical trials, and I work at Massachusetts General Hospital and Harvard Medical School in Boston.
And my name is Christy Leonard. I'm a mom, stepmom to 5 boys. My husband, Tony, battled stomach cancer for 7 years. And during that time, raised the 5 boys and blogged our entire journey, which recently got published into a book called Seriously Cancer, Seriously. My husband and I founded the North Carolina East chapter for an organization called Debbie's Dream Foundation. I sit on the board of directors, and I'm just proud to be here today. Thank you so much.
Great. Well, I thank both of you. Doctor, when it comes to stomach cancer, what are some of the risk factors and some of the symptoms that are associated with the condition?
Yeah, good question. So like any cancer, it's related to things from the outside, environmental risk factors, choices we make, things we're exposed to, where we live, etc., and things that are intrinsic to us, genes we're born with, things that are passed through families. Among the environmental factors, a bacteria called H. pylori probably accounts for the vast majority of stomach cancers. And then other things like diets that are high in salt-cured meats, high salted foods, less risk factors like obesity, smoking, alcohol. But really, the end result is things that cause chronic inflammation in the lining of the stomach increase the risk of developing a stomach cancer.
Is it easily diagnosed? Do these symptoms mimic some other conditions that are in no way related to cancer?
Yeah, this is a tough one because most of the symptoms are very non-specific. They may be fatigue. They may be feeling like you're full very quickly after eating, what we call early satiety, weight loss, sometimes dark stool from GI bleeding. But of course, all of us have fatigue, and cancer is not the most likely explanation for the vast majority. So it's one of the reasons that it's a more difficult cancer to diagnose and often results in patients presenting later on in the disease course, which is something that we all need to work on getting better at.
Christy, what led to Tony's diagnosis? Was he symptomatic, or was there some routine checkup that led to his diagnosis? How did that happen?
It was a combination of a couple of things. Tony was diagnosed with irritable bowel syndrome when he was 33, continued to have stomach issues. However, that's what the diagnosis was, and that's what we thought, everything that was happening was a result of. However, when he was 39, we went in for our annual checkups. It was actually his birthday, and he was having a little burning when he ate. So I had mentioned to the doctor, because Tony was the type that he never would tell the doctor what was going on. So I told the doctor, hey, there's something going on with his stomach. Don't let him not tell you. We had a phenomenal, primary care doctor who said, I'm not the expert. And he sent him straight to a GI doc who did an endoscopy and found the stomach cancer.
November is also National Caregivers Awareness Month. Had you had any experience with being a caregiver before you became one for Tony? Of course, you're raising children, but it's a totally different arena.
Right. I was going to say, other than changing diapers, absolutely not. It's very, very different. And it is a world that, honestly, I'm blessed to be a part of. I learned quickly how to balance being a mom, working a full-time job, and then, stomping my feet and advocating for my husband. I did not take no as an answer. And if the answer was no, my next question was why.
Doctor, when it comes to treatment options, were the options that were available for Tony pretty much available for anyone with this type of cancer, or does it vary, and are those options evolving?
Yeah, I think the evolving part is really the most important. So the treatment options really depend on the stage of the disease, and that guides how we approach the cancer. But the toolbox is expanding. And so we have chemotherapy, which is the main tool that we've had for years. But more importantly, as we understand what makes these cancers tick and sort of look under the hood at DNA mutations and protein expression, we now have, even within the last year, several new approvals for new agents. And these might be immune therapies, targeted therapies based on a specific protein, and even newer combinations of chemotherapy. So the tools are getting better, and the outcomes are getting better thanks to better understanding. So it's really, the more we understand about an individual tumor, the better we can sort of tailor the therapy. And those are the biomarkers that really is critical to test for in all these newly diagnosed patients.
Christy, as you raise awareness of the challenges that a caregiver faces, what are some of the things that you've learned from other caregivers, and what are some of the things you wish they had told you, and how are you getting that information out to new caregivers?
Great question. I always say caregivers need caregivers, and there's some amazing advocacy and support groups out there that can be just that. Debbie's Dream Foundation is one of them. You can find them at www.debbiesdream.org. I found everything that I needed, other caregivers to talk to that encouraged me to ask questions to the doctors that I didn't even think to ask. We get very short time with doctors, so it's what happens when we get home. How do we balance kids? How do we balance school and work? And when do I call the doctor? When do I not? How do I make sure that I'm making the best decision, not only for my loved one, but for my family? I had to keep 5 boys' opinions and thoughts all, on the front of my mind. They wanted dad at their football games, so we had to have chemo on Monday so that he could be at the football games over the weekend. It's just a family decision and conversation to have. And thankfully I had other caregivers to talk to. And finally, if you are a friend to a caregiver, show up with a cup of coffee or some, company, or show up with a lawnmower, offer to pull up your sleeves and do some laundry. It's, we definitely need support, and, that helped me the most.
Doctor, talk briefly about the role that biomarkers play within the treatment landscape and the early detection landscape, if you would.
Yeah, this is really the way that the whole field of cancer is going. And it's basically trying to understand what we can about the tumor to pick the therapy. So biomarkers currently are like HER2, PD-L1, and what's called MSI status. But there's a whole host of other new biomarkers which are linked to drugs that may be coming in the future. So we have FGFR2, Claudin 18.2. But the take-home message is really just the more we understand about any person's given cancer, because all of our cancers are going to be different, the better chance we have of picking a combination that's going to be the most active and give that individual the best shot at a cure or long-term disease control. And so biomarker testing is really the way to do that. And probably the take-home point for providers and for patients is really just try to know and make sure that the biomarkers have been tested in stomach cancer.
And Christy, once again, that website where we can learn more.
Yes, it is www.debbiesdream.org.
I appreciate both Christy Leonard, Dr. Samuel Klempner. Thank you both for joining us here on Health Professional Radio this morning. It's been a pleasure speaking with you.
Thank you.
Thanks, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Samuel Klempner and Christy Leonard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.